To understand what is an organoid, you have to imagine the possibility to grow in 3-dimension tissue in a way that it will resemble how the tissue is functioning and all the characteristics of the tissue when it is inside the body. So imagine that you can take a piece of tissue, grow it in special conditions and have exactly the copy of the tissue in the body. So organoids are created out of a tiny piece of tissue that we obtain from animals or from human beings. In the hospital we do mainly from human beings, and we dissociate them, and then we grow them in specific conditions that have been established by many laboratories around the world. And it is important to say that this technology has been pioneered in the lab of Professor Hans Clevers in Holland. And then many laboratories like ours are using this technology to grow these tissues. So we put these cells in a kind of gel, and they automatically they can self-assemble and recreate the structure of the tissue that you can observe in the body of an individual. In the center, in the Hadassah Organoid Center, we are able now, we were born 2 years ago, 2 years and a half, and we are now able to grow organoids out of most of the tissues in the body, including lung, stomach, liver, intestine, endometrium, ovaries, etc., etc. In oncology, we are really working hand-to-hand with oncologists at the Hadassah hospital. And for example, we had the case of a 42 years old woman who came with metastasis in her lung, coming from breast cancer. And Dr. Tamar Peretz, when she contacted us, she said that she is too fragile to undergo another biopsy. So we tried to take out the cancer cells from the lung, from the little bottle that she has for draining the liquid from her lungs, and we succeeded in culturing her tumor out of this liquid, and we could try different combination of FDA-approved drugs in consultation, of course, with the oncologist. And we were able in something like 10 days, 1 week to 10 days, to provide an answer to the oncologist, to tell her, use this combination of drug and not this one, because this one will not work. The other one, it works on organoids, so it has a better chance to work on the patient. We are already collaboration, of course, with basic science researchers from all the university in Israel, including Tel Aviv, Weizmann Institute, of course the Hebrew University, which are really close to us. We are collaborating with clinicians from the Hadassah Hospital, from Shaare Zedek a little bit, and our aim is really to offer this platform to all the hospitals in Israel. And we are working with companies. That want to test their drugs, test their antibodies, different treatment, or other things. So the way we work with these people is or to offer them to come to our facility so that we can train them and they can grow by themselves organoids. That's something that it's really important for us to disseminate this technology in Israel, so that as many lab can use this great technology. The other thing that we can offer is to give them our organoids that are frozen in liquid nitrogen and can be revived and used again by all the people that need them. And the other thing that we do is to really do the experiments in the center according to what they need. So we sit with them, we plan the experiments, and we do that in the lab. In 5 years, I guess that we will be able to really model the disease in the dish, to have what we call a patient in the dish, and to test so many different things, basic science, research, drugs, etc. But if you can continue to a longer vision, I guess that not so far in time, so in a long time, we will be able to grow these organoids in very sterile conditions, etc. And we'll be able to retransplant these organoids to repair injured tissue. And we have actually a little project in the lab that we are initiating now about repairing the endometrium of women that have scars in their endometrium and which render difficult to get pregnant. So we had this idea with Dr. Shai Porat, a gynecologist here, to take a piece of their endometrium, to grow it in the lab in good conditions so that we produce a healthy tissue, and then try to get it back in the endometrium. So we do that, of course, in mice first, and then if it works, we could imagine to do that in women.